Respected Dr. Agarwal, my dear seniors and friends, it's wonderful that we are having this reunion this year, even though it's digital. And I'm sure nobody will mind my background here on the Zoom. Uh, well, I know that you're eagerly waiting for my presentation, so I'll get right to it. Here we go. One sec. All right. So what I'll be talking today is regarding the global burden of disease and the India state level disease burden initiative. And I'll be covering my journey and my association with Global Burden of Disease group and a little bit about the history, a few salient points about GBD, a little bit about DALIs, and finally, the most interesting part of my presentation will be the GBD visualizations or the GBD Viz. And we also have the India Viz, and I'm sure you will find it very useful in your work uh, when you look at the visualizations. So most of the time, kids get asked a simple question: what do you want to become when you grow up? Well, for me, I always wanted to become a doctor, and I did become a doctor in JIPMER, but I got more interested in research than in clinical medicine. One of the reasons for that also was that because I wanted to know the big picture. I wanted to know the world outside the boundaries of the clinic or the hospital, because I knew that most of the determinants of health and disease lay there. And thankfully, I can say that today I am aware of how things work in terms of health systems and much more. So I published my first paper in my third year MBBS with Dr. Pankaj Kundra, and that was the beginning of my journey into research. I went on to do my MPH and PhD in epidemiology at the University of Michigan, and joined in India, Public Health Foundation of India as assistant professor in 2010. And I finally left my academic position in 2017, and I now head my own nonprofit called Disha Foundation. DishaFoundation.ngo, that's a website. You can go there, take a look at it, look at some of the work we are doing. We also do a lot of public health work, including TB elimination. And one of the most recent projects was we distributed UVC chambers during COVID times to COVID hospitals in 8 states of India. We also donated them to JIPMER and to Indira Gandhi Hospital. In terms of research, my main research area has been cancer epidemiology, and my PhD was in cancer epidemiology and environment. So I also forayed into a few other areas, including migrant health currently. So I have around 70 publications in international journals and some books and book chapters as well. I got introduced to global burden of disease or GBD in 2016. I went to Greece for a workshop, and that's where I came to know about the entire methodology. And that was the beginning of the collaboration of global burden of disease group with India in terms of uh, tripartite collaboration between PHFI, ICMR, and IHME. And I was leading the cancer burden group in the state level burden of disease initiative, and I was also working with other groups. So, in terms of history, GBD began in 1990, funded by World Bank, institutionalized in WHO, and the findings were part of the World Development Report in 1993. It started with 107 diseases, and we will see that it has really grown at the moment. It was updated by WHO in 2001, 2, and finally in 4. All of these co-authored by Dr. Christopher Murray, who is the director of IHME in Seattle and who heads the GBD group. And the major update came in 2010, though, and by that time, GBD had moved out of WHO to IHME. The inside word is that there was a lot of politics between countries on the disease burdens at WHO. So, funded by Bill Melinda Gates, finally this moved to IHME, and by 2010, as you can see, 291 diseases. and a lot more countries. So major updates came then in 13, 15, 16, 17, and finally in 19, by when it was planned that there would be annual updates, but COVID happened. But in spite of that, 19 was the last major update. It had 204 countries, 990 locations, including subnational locations, and a big list of 369 diseases and injuries. Jubilee 2017 onwards, there were 11 countries which had subnational estimates. So India was one of them, and that's when we had the collaboration and started producing subnational estimates for India. So most of the GBD findings are published in Lancet. This is the 2019 page of Lancet for GBD, and you can visit it, go through the peer-reviewed journal articles, and you can know more about the methodology and all about the risk summaries, etc. On this page. For India, this was the first major paper in terms of defining the state level burden. So nations within a nation. Each of the states of India is like a small country, and in terms of diseases also, there's a huge variation between the states. This was the paper I was mainly involved in, the burden of cancers and their variation across states of India. And this was the first such paper which defined the burden of cancer in the states of India. So why GBD? Why should there be something like GBD? Because we need a way to estimate burden of disease in terms of applying health policy. Because in terms of health funding and health policy, we need to distribute a limited number of resources across diseases, space, and time. And for that, we need a comparison between diseases, space, and time. So GBD was able to create such an estimate. It's called DALI, Disability Adjusted Life Year. And every time GBD methods are renewed, all the previous GBD estimates are revised as per the most current methods. And all the GBD methods and outputs are freely available, published in peer-reviewed journals, and available as visualizations. So I'll definitely get into the visualizations because they are the easiest way of looking at how GBD works and most useful as well. So DALI is the center point of GBD in terms of defining the disease burden. It's made up of two estimates, YLL and YLD. YLL is years of life lost due to premature death, and YLD is years of life lived with disability. So we know that different diseases cause different effects. Some diseases cause more mortality, some diseases cause more morbidity. And this provides a way in which we can bring both together and we can compare different forms of diseases that have these different effects. So I will not go more into the methodology of it because it's quite complex, and billions of data points are used in different ways of modeling, mostly Bayesian methods. And as far as we were told, there's a supercomputer sitting at Seattle, which is busy every second of the day. So the fun part here is the live demo, which I'll get into right now. And for that, you just need to Google GBD Viz or GBD Compare. And what we will get into is this link. And on clicking this link, you will come to this, this page. And this is how these are different functions of the visualization here. And this one is called the tree map. And this looks at the contribution of various diseases in terms of burden. Let's click on advanced settings. And here we are looking at DALIs. For ease of explanation, let's go to deaths. And we are looking at global level of deaths. And there are different levels of diseases. We'll start with, let's say, level 1. So at level 1, there are 3 major categories of diseases. There's NCDs, there's group 1, and there's injuries. And as you can see, globally, NCDs cause or contribute maximally to deaths, 74.37% of total deaths, and that's the 95% confidence interval. And there's also the annual percentage of change, which you can also see on this side here. If we change the levels, we get further sub-classification of diseases. Level 3 is the default. You can also go to level 4. So globally, if we let's make a comparison. So you can look at different levels or different categories of countries here by their socio-development index. So low SDI, high SDI, and you can of course look at any country in the world in terms of what is the distribution of diseases. If we look at low SDI, you'll see that the red goes up. There we go. The contribution of group 1 diseases to deaths is much higher when compared to, let's say, if we look at high SDI, which are the developed countries in the world, and you can see that the blue almost takes up the entire space here. So you can also look at different ages, age groups, male, female, and you can look at risk, etiology, impairment, injuries by nature, etc. Another amazing function is a map where you can look at the globe in terms of countries. And here you can see that we are looking at the entire world and all the 204 countries in GBD 2019. You can, by the way, change the year. So you can go to previous years and so on. And so we are looking at currently all causes, but all the 369 diseases, as we mentioned, are here. So you can look at any disease of your interest you want. We are looking at rates here, and we are looking at all ages. We can also use age standardized rates. We are looking at detail level 1. If I go into a finer detail, you will see that subnational estimates will appear. For the sake of example, let's look at tuberculosis. Tuberculosis, as you can see, is the rates are very low across the world. This country stands under the Central African Republic. If you click on it, there you go. So there's a scale here which also ranks the countries. So Central African Republic is #1 in terms of rate of deaths due to tuberculosis. What if I click on numbers? Any guesses on which country will light up? Let's see. Voila, India lights up, maximum number of deaths due to tuberculosis. You click on India, this point also gets highlighted. And if we look on the scale, Indonesia is a distant second in terms of number of deaths, but let's stick to rates for now, and let's go to all causes. And I want to show you the effect of changing details. So if you go to level 2, you can see that some of the countries will have their subnational estimates light up. So for example, you have USA, which is all the states here, Mexico, Brazil, Kenya, Indonesia, etc. You can also change details further. Here, I would like to zoom into, let's say, UK, which has very finer subnational estimates. So if you go to level 3, you will see that, so at level 2, you have the different kingdoms which make up the United Kingdom, and then England, Scotland, Wales, and so on. And at level 3, you get further subdivisions within those, and so on. So this is one of the major functions of GPD visualizations. There are many other functions. One interesting function is, let's say, the arrow diagram, where you can look at the rankings of different diseases. We are in India. Let's get out of India to global. And you can see that in terms of deaths globally, compared to 1990 to 2019, you can see that ischemic heart disease and stroke, they were 1 and 2 in 1990, and 30 years later, they're still there. But COPD made a jump from 6th place to 3rd place. You can do this for different causes. You can do this for different estimates and so on. Another very interesting function here is the heat map. So the heat map basically shows the ranking of causes of death by country. And right now, I've clicked on US. So the first 25 causes of deaths in USA are highlighted here. And every other country has got ranked as per the ranking of US. So ischemic heart disease, which is #1 in India, in United States, is #2 in China, and so on. What if I click on India here? So everything will get ranked as per the diseases of India. So the second highest cause of death in India is COPD, third is stroke, and so on. But as you can see, COPD in Japan is 9th, or in Angola is 19th, and so on. For example, United States, lung cancer is the second highest cause of death, but in India it's 18th. So you can look at these different rankings of causes of disease by cause of deaths by country. We have done a similar thing for India. You can freely explore all these other functions. I just covered the most major ones and the most interesting ones, but there's a lot to do here, and you can also look at some of the other visualizations, including COVID-19 projections, etc. So this is something which you can use in your work, in your academic work, in your research work, when applying for grants or when making a case for a certain policy. You can use figures. You can cite global burden of disease work for your purposes, and this hopefully will be an amazing tool that you can use in your work in the future. A similar thing for India. If you Google GBD Compare India or GBD Viz India, you will land up in this page for India. And we have the same thing as we saw earlier globally for India in terms of states. So if we look at, let's say, a lesser developed state like Chhattisgarh, you'll see that the red goes up compared to a developed state, let's say, for example, Goa. You'll see that the blue takes up most of the space. We have the map here, and you can use it in a similar way as I just showed it for global. You have all these other functions here, the ranks, heat map, and so on. So this is the GBD visualizations which you can freely use. Like they say, you don't need to know how the car works to drive the car. So this is one way in which you can drive the car and look at kind of like a global crystal ball in terms of disease burden. And I hope this will be useful for your work. Going back to my presentation, I already covered this. Thank you for your time and attention, and I hope that this will be useful for you.